Good evening. We are live at 7 o'clock. I'm Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Southside Hospital to help you sort through what's going on with COVID-19 in our communities and across the region. And we always want to hear from you. This is a call-in show, so please call in. The number's right there at the bottom of your screen, 516-393-1800. All right, all New Yorkers will now be required to wear face coverings in public when they can't maintain a social distance of 6 feet. Governor Cuomo issued that executive order today. That's set to take effect this Friday. He says it's all part of stopping the spread and realizing our new normal. Yeah, our new normal. The governor says he's beginning to map out a blueprint on how to unpause New York as safely as possible. He says it will be phased in. Now, we are still in the woods. The governor says we're still getting hundreds of new diagnoses daily. Statewide, we're now at almost 214,000 confirmed cases. Nassau numbers still on the rise, upwards of 26,000 infected with the deadly virus. Suffolk County executive today saying even though there are more than 23,000 coronavirus cases, 174 people were discharged, which he says is a milestone for the county. And the death toll rising at a pretty unfathomable rate. COVID-19 claiming the lives of more than 11,500 New Yorkers. You see the number right there. Nassau, more than 1,050. Suffolk, more than 650. More than a third of Long Island's deaths have been at nursing homes or adult care facilities. And inmates, this may be surprising, Suffolk County Correctional Facility doing their part to help their fellow inmates during the crisis. The inmates are sewing hundreds of cloth masks to be handed out to other incarcerated folks. So far, they've made more than 800 coverings and expect to have 1,200 by the weekend. And for the research side, they're looking for donations of plasma from COVID-19 survivors to see if, in fact, it can help the sick. Doctors at Stony Brook University Hospital conducting one of the numerous clinical trials involving convalescent plasma. They say they do need 150 approved plasma donors, and Catholic Health Services taking part in a separate plasma study that's being led by the Mayo Clinic. And Nassau County Executive Laura Kern announced license extensions for struggling businesses. She says the county will extend the license expiration date by the length of this crisis. This will apply to home improvement contractors, for hire vehicle operators, and others. And after 4 weeks in Peconic Bay Medical Center, this is a great story. On a ventilator, battling coronavirus, a Cutchogue man gets a well-deserved recovery parade. He is only the second person to be discharged from that North Fork facility after being on a ventilator. The 66-year-old, father of 6 and grandfather of 12, described his experience as, quote, like getting hit by a truck, and then that truck backed up and ran over me again. All right, let's get to our discussion. Joining us tonight, Dr. Sanjey Gupta, Chair of Emergency Medicine at Southside Hospital. Dr. Gupta, I appreciate your time. There you are. I just want to say first from everyone, thank you for all you're doing. How are you doing and how are your colleagues doing right now?
I think we are hanging in there. Fortunately for us in emergency medicine, we were kind of always drilling and training for this sort of thing. If I go back over 20 years, Ebola, SARS, avian flu, it just so happened that this outbreak was, took on a life that none of the others really did. So fortunately for us, we've had that training in the past, but, kind of dealing with this, I think everyone has really stepped up to the plate. The amount of teamwork that we've seen not only in our department, but in the hospital, it's not like anything that I've seen before. And it really is, it is really uplifting to kind of see everybody working together for the benefit of the patients.
Yeah, I know.
In the hospital.
Southside and Bayshore. It's you guys are getting hit pretty hard. Are you seeing plateauing in the numbers as far as being discharged versus the admissions?
Yeah, that's a good question. From our most recent data, we have very frequent kind of network calls within Northwell Health. So this past 24-hour period was the first 24-hour period where we've seen admissions actually go down. So what has been occurring recently is that our overall number of ER visits are down, but our number of kind of ill patients with COVID disease or presumably COVID disease is definitely kind of the predominant type of visit, and we are admitting a lot of those patients. But the really positive thing is that actually the number of admissions for the first time we noted seems to be going down. So we're going to keep our fingers crossed and stay positive about this movement.
Okay, let's take some callers right now. Jim from Melville. Jim, you there?
Yes, hi. Hi, thank you for taking the call. I wanted to know if getting your annual flu shots gives you any degree of protection against this virus. Is there any data about that?
Yeah, oh, that's a very good question. The truth is, I would doubt that anyone has actually studied this to a big extent yet. I would advocate getting your annual flu shot because that's going to protect you from the flu, of course, which has its kind of own ill effects and consequences. But right now, we don't actually have any evidence. We don't really know if any of the other kind of seasonal vaccinations that you can get will protect you from the novel coronavirus.
Yeah. Let me follow up on that too, Doctor, because I get this a lot on social media, variations of this question. I know that there is a vaccine for bacterial pneumonia, and I know this is a respiratory virus, but if you get the bacterial pneumonia vaccine, does that help you fare any better for this?
Yeah, I mean, again, so an excellent question. I don't know if it would directly benefit, not getting the novel coronavirus, but what it might help from is you getting what's called preventing you from getting a secondary infection once you've had the novel coronavirus. And what that means is you can develop a pneumonia from the coronavirus itself, but for a small segment of people, they can actually get a bacterial infection afterwards. And that's, just kind of going back to the last question, that's one of the something that becomes very problematic with influenza. Influenza by itself can be dangerous, but then getting a bacterial infection, co-infection it's often called, or a secondary infection is something that can happen. So getting that pneumonia vaccine can help prevent a secondary infection.
Okay. Back to the phones. Debbie from Huntington. Debbie?
Hi. What is the reason landscapers and or homeowners should not be using a leaf blower?
A roof
should not be
using a leaf blower.
Oh, leaf blower. Doctor?
Not be using a leaf blower. I mean, I guess one of the concerns about this virus is how long it stays kind of patent on surfaces. There have been some studies done in labs where it demonstrates that the virus kind of stays patent on stainless steel for 3 days, and copper for 4 hours, and paper or cardboard, for 24 hours. So I think the thought would be is if there is virus on leaves and you are blowing the leaves, you could potentially what's called aerosolize the virus. The thing is, many of those studies are done in laboratories. I don't think anyone probably has a very good sense about how long the virus would actually live on leaves or on grass. Presumably, it would not be for a long time. But we really don't have a great sense of that. So right now, anything that might blow the virus into the air, where that could, where the virus could then contact your nose, your mouth, would probably be avoided. Should be avoided.
All right. Let's go to Maureen from, is it Farmingville or Farmingdale?
Farmingville.
Farmingville. What's your question tonight?
Doctor, I wanted to ask a question. Do you believe that the cases right here on Long Island are underreported? And the reason why I'm asking is specifically because my daughter's husband had been sick for a while, couldn't get tested, finally got tested positive for the virus, and then she was told not to bother getting tested because she probably had it. And to me, I realize that we are obviously not having enough tests, and this is really obviously going to affect the curve, the amount of people that actually have the virus, and what's your feeling on that?
Yeah, I think one of the challenges we had early on, and we've had actually even nationwide, was the limited ability to test people for the virus. And, the thought is now that this virus was already widespread in New York, or spreading by mid-February. So, it was very hard to discern if someone was coming in with a cough, a fever. That could be any number of things, and it could have been the novel coronavirus. But we had really no ability to test. And even when we got the ability, it would be limited ability. So I'm sure the numbers that we're seeing reported are the numbers from tests. But for every one person that's positive, there is going to be, an X factor. There's going to be several more people who have been positive. And one of the challenges that we found with this disease is also the variability in the way that the symptoms present. So it's estimated that 25, even up to 50% of people are asymptomatic who have it. So you could have had novel coronavirus and not even known, or the symptoms are so mild that your symptoms are gone in a day. We found that things that were never reported out of the Chinese data, we're seeing in pretty high numbers, and those sort of things are like abdominal pain, nausea, vomiting, diarrhea. So you may have thought that you had food poisoning, and it actually could have been the novel coronavirus. So we don't have a good sense at all about the actual number of people who have been infected, and this is why there's a lot of talk now about antibody testing coming up, and trying to make that widespread to check your blood to see if you actually have had the infection.
Doctor, how far along are we on the antibody testing? Figuring out, are we ready for mass testing on that?
Yeah, that's a good question. I was just reading today that there are several labs around not only the state but around the country developing these antibody tests. And I think the challenge with that will be getting FDA approval for the test or fast tracking that, but then also mass producing. And then how is that test going to be distributed so we could get large sectors of the population tested? So something that might require a blood draw might not be something that is tenable for everyone, but if it's a finger prick, then that might be better. If it's a saliva test, that might be easier. So, I think it's going to really depend on how available the test is, how getting the test is going to be covered. Is it going to be covered by insurance? Is it something that, and kind of the ease of access for that test.
Yeah,
so,
my understanding it's more like a litmus test, where you have a little bit of the virus on the stick and you add a drop of blood to it and see if it reacts.
From what I've seen so far, that seems to be the test that's predominant. Something like that seems
okay.
Kind of easy, and I think would probably be very helpful for us if we wanted to get very rapid mass testing up and going. Something in that format seems like something that could be tenable for a wide sector of the population.
All right. Well, we're going to take a real quick break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you, so call us at the number right there at the bottom of your screen. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in the doctor, Dr. Sanjey Gupta, Chair of Emergency Medicine at Southside Hospital. Before the break, we were talking a little bit about some of the ways to treat this, and I want to ask you about the convalescent plasma trials. Just in general, when you start a clinical trial, typically how long do you see before it becomes viable for the public?
Yeah, Stone, that's a really good question. These are not normal times. So usually with clinical trials, there's several layers of safety and kind of protocols you have to go through and approvals. So many of these things are being fast tracked right now, I think, because of the global concern about this disease. So the convalescent trials, I think, right here. I think, unfortunately, they're not probably being conducted in the way that you would do this in a pure sense, because we're also doing these trials hoping to save people's lives. So I think I'm probably not giving you the best answer, but I think the data that we'll get from providing convalescent plasma for the treatment, we'll get some positive or negative information, but it's really going to be dependent on the number of doses we get out. So that's why it's important for anyone who actually has had COVID disease and who qualifies, please donate so we can trial this with patients to see if this is actually a treatment and a practice that that we want to continue for people. So there have been other viral illnesses like Ebola, for example, where convalescent plasma was used to care for patients who were infected with Ebola with some success. So we're hoping for kind of the same effect with convalescent plasma in coronavirus.
Okay, let's go back to the phones. Bridget, are you there?
Yes, I am.
Thanks for calling. What's your question?
Okay, so this question is for Dr. Gupta. For a person who has been quarantined, who has been tested positive for the virus, in quarantine home for 2 or so weeks. When is it safe for that person to be around family members, especially with kids, and what precautions should be taken?
Yeah, I mean, I think that's an excellent question, and that's a question that comes up a lot. So if you have tested positive, what the recommendation now is that you should be isolated for a minimum of 7 days. But also with that, you should also be symptom-free for at least 3 days before you become in contact with anyone else. So let's say you test positive and you have symptoms for a day. If 5 days, you should go out the week. But let's say you have tested positive and at day 7 you're still feeling symptoms, you still have to be isolated. So it really should be kind of 7 days, and you have to make sure at minimum, but then you also have to make sure that you've been symptom free for 3 days with that.
Okay. I think Nairi is waiting. Nairi, are you there?
Yes, I'm here.
Thanks for calling. And what's your question?
Hi, Dr. Gupta. How are you? And Stone, how are you?
Doing well.
My question is this. A couple of years ago, I had a nasty, nasty bout with the flu, and I ended up with sublingual tonsillitis along with that flu. It took my body a good 3 to 4 weeks to beat the flu, but it took my body at least 2 months before I could fully recover and get back to normal the way I was. Now, does going through something like that build up any type of resistance for when the coronavirus did hit or anything like that? Because I haven't experienced anything, and I've worked very closely with some people who have caught it. I know about asymptomatic from watching, News 12 and other reports, but I was just wondering, when you go through something like that, does it build up any type of resistance towards this?
Yeah, I mean, that's a really excellent question. When you're exposed to the flu and you have a response from your immune system to the flu, you develop antibodies for that specific disease. So thus far, we haven't really, I've not really heard about any of what's called kind of cross reactivity or cross safety. So I don't know if actually having the flu and having an immune response to the flu actually gives you any sort of safety against the coronavirus. It would be great if it did, because I know a lot of us have had the flu, but it doesn't seem like that is the case that we know of so far.
Doctor, I think some of the viewers might be interested. How do you protect yourself on a daily basis? Any advice for Long Islanders?
Yeah, I mean, that's a great question. For myself, because I have a family, so personally, I've never washed my hands so many times in my life. I'm going to be honest. My knuckles are kind of cracking with being so dry. Part of that is also being in the hospital every day. But, kind of the safe things, again, same things. Keep surfaces clean. Keep your hands washed. If you touch a surface, wash your hands. That could be with alcohol gel. Should be something over 70% alcohol content. But regular soap and water is great. That breaks up. But what this virus is, it's a piece of RNA wrapped in kind of a encased in protein, and regular soap will break up that protein, so it should break up the virus, so it's not infected.
All right.
But then, sorry.
Oh, I'm sorry.
Go ahead.
We're running just out of time, and I just want to make sure that I thank you once again for everything that you are doing. You guys really are the heroes on Long Island, and we appreciate you, all of us here. It's just amazing all the work that you do. Thank you so much for taking the time to speak with us and for everything you do during the day. And thank you for your calls. We'll be back at 7 o'clock tomorrow night, so call us again.